He is a medical doctor in dentistry and also with a master's degree in tobacco control. He's formerly the president of Spanish Committee on Tobacco Control and also vice president of the Spanish Dental Association. So please, Francisco, I'll pass the word to you.
Thank you very much, Paulina. Thank you for the invitation, and thank you to all the attendees for being today. That I think we are facing a very, very interesting matter. I'd like to explain or to present you the idea that we have in Spain in order to share it with you and maybe to learn from each other, because I think we are in a network and it's interesting to know what are doing different countries, and sometimes we must copy or we can copy what it has been a success. And I think we are facing this problem in Spain, I think, in a very, very new way. Along the last months in Spain, we have observed an increase in actions promoted by the tobacco industry, especially Philip Morris, aimed at conveying the message to public opinion that the new tobacco products are not dangerous. Especially worrying for us is the fact that some physicians or medical doctors are using these campaigns. In an apparently voluntary way, they collaborate in all these actions, which include conferences, roundtables, etc., which afterwards have a relatively high impact in the mass media, usually through paid articles and associates. The tobacco industry is seriously concerned. Half of its customers die prematurely from tobacco use, and among the other half, a non-negligible percentage decides to stop smoking, mainly driven by a greater perception of nicotine and tobacco risks. In order to continue generating economic benefits for themselves and their shareholders, it's absolutely essential for tobacco companies to maintain the normalization of tobacco consumption, of nicotine addiction, and to convince their customers that their new products are quite less dangerous, independently of if they are so or not. What they never mention are the real chances of quitting that all smokers have when they try in a serious and continual way. They keep insisting, saying that there are people who cannot or do not want to quit smoking, fostering and lengthening the ambivalences that all consumers of any addictive substance perceive and reinforcing their mechanisms of denial. Simultaneously, they present the indiscriminate spreading of their new products as the main way, and sometimes the only one, to reduce harm. But we should always keep in mind that harm reduction is something developed by physicians and health professionals, not something new they have just invented. We use harm reduction with other drugs such as heroin, flumethadone, but always in an individual way and under medical supervision and prescription. Whenever we use it as a harm reduction strategy, methadone is not freely sold in department stores, gas stations, or shopping centers. That's the way it should be, if in the end these new potentially harm-reducing nicotine products were to be used as harm-reduction strategies. The tobacco industry is not and will never be part of the solution. They are and will always be part of the problem. In fact, they are the problem. As it is stated in the guiding principle 1 of the guidelines of Article 5.3 of the WHO FCTC, there is a fundamental and irreconcilable conflict between the tobacco industry's interests and public health policy interests. And so it is. Although some tobacco companies say they want to stop producing their traditional cigarettes and produce less dangerous products, the reality is that they continue to sell their extraordinarily lethal traditional cigarettes and even in some third world countries launching new brands of them. In most industrialized countries, tobacco industry interests lie no longer in keeping its clients hooked to conventional cigarettes, but to maintain a portfolio of customers addicted to nicotine in any of its forms. That is their real business. And therefore, they try to convince us that nicotine is not toxic at all, just a little bit addictive for those already addicted. But this is not true. We already know that nicotine, in addition to being tremendously addictive, it can be extremely toxic when consumed by the inhalation or intravenous route. In the United States, we have been witnessed how a new generation of children and young people who practically no longer smoke, the prevalence had dropped dramatically, has to become massively hooked on nicotine again through the Juul phenomenon and through other electronic cigarettes, being in many cases even shown to be a gateway to traditional tobacco consumption. They have also developed heated tobacco products, more oriented, in this case, to adults, trying to convince us, with nearly any evidence at all, that they are clearly less toxic, more healthy, like they like to remark. Well, as a result of this, Armando Peruga, Rodrigo Córdoba, Esther Fernandez, and myself, with the support of other scientists, wrote a manifesto to which we wanted a large number of renowned health professionals and experts in the field of smoking to adhere. The CNTT, the National Coalition for Tobacco Control, was in charge of collecting adhesions. It was obtained the adhesion of the main health professional associations like the Spanish Medical Association, the Spanish Dental Association, the Spanish Psychologists Association, and so on. Practically all scientific societies in Spain, as well as a large number of professors from Spanish universities and also Spanish professors teaching at prestigious North American universities. A large number of heads of hospital departments from the main Spanish hospitals and renowned experts in smoking and tobacco control in our country adhere to the manifesto. At the time of the presentation to the media in a press conference held in November 11th at the headquarters of the Spanish Medical Association, there were already 167 signatures. This action plainly shows that although the tobacco industry argues that some health workers support its strategy, the vast majority of professionals, as well as all scientific societies in our country, as the WHO did in its day, clearly disagree on the utility, if any, of these new products for any public health-based strategy of reduced risk or harm reduction. And I would like to read the manifesto that, of course, you can find in the web page of the ENSP, and we can look also to the main signatures. And the manifesto is very simple. It's just one sheet. It says Spanish Manifesto on Novel Tobacco Products. The undersigned, presidents of professional health associations, presidents of scientific societies, university professors, heads of hospital, primary care, and public health services states. The tobacco use causes at least 69,000 premature deaths in Spain each year, and the loss of more than 1.7 million years of life annually. In addition to thousands of novel chronically ill patients, which results both in human suffering and great burden on public health. Over the last decade, legislative measures have played an important role in reducing cigarette consumption by half. In the recent years, the tobacco industry has expanded and reoriented its business by marketing heated tobacco products such as IQOS, Glo, etc., and electronic cigarettes such as Blue, Logic, Juul, IQOS Nest, etc. These novel products are being aggressively promoted to young people in order for the industry to compensate for the decline in conventional cigarette sales. To that end, among other tools, the tobacco industry is using marketing strategies through social networks and mass events for young people. For instance, hiring influencers with thousands of followers, appealing to their audience with unusual public relations strategies. The industry of these novel products distorts the scientific evidence to the biased and one-sided use of the term harm reduction, a concept originating from public health. They present their products as a strategy for individual harm reduction, even as a strategy to quit smoking, without sufficient scientific or empirical evidence of this, and without taking into account the implications for the health of general population that this strategy entails. They offer their novel products as the solution to a problem that they have created and continue to sustain. Some companies have been condemned by the judicial Spanish system for illegally promoting their heated tobacco products. The industry hides that between 60 to 90% of users continue to consume both cigarettes and novel products. They are dual users. So the addiction and the real risk are not reduced substantially or significantly. It is not the first time when the tobacco industry, nicotine addiction industry in reality, has tried to promote its novel products as healthier ones. Cigarettes with filter, light or no nicotine tobacco, premier cigarettes, etc. Aside from reorienting their niche markets, it's clear that they seek to circumvent or at least postpone a stricter regulation on their novel products. What they are really concerned with is the efficacy of tobacco control strategies to denormalize the use of tobacco products. It is evident that the tobacco industry is still a part of the cause of the tobacco epidemic. There is no sign that they are part of the solution to it. The evidence shows that the control of this epidemic will not be based on novel products from tobacco companies, but on tax increase, plain packaging, complete ban of product display and advertisement at the point of sale, supported by strong bans on smoking and use of novel tobacco products in public spaces, and increased provision of effective smoking cessation services as stated in the Madrid Declaration of 2018, a document that highlights the most relevant points of the WHO Framework Convention on Tobacco Control, the agreement signed by our country, Spain, and the European Union. And now we can see a little bit, just the signatures when we presented this in the Spanish Medical Association 20 days ago. As you see, they are the presidents of all the main scientific societies of Spain. For instance, the Spanish Society of Cardiology, of Pneumology, of Internal Medicine, of Oncology, of Epidemiology, of Public Health. We have also the president of the Spanish Medical Association, Dental Association. We have the associations of nurses, and also we have. We pass the next. We can see. Please go on. And we have also well-known professors of all the universities in Spain, of all the faculties of medicine and health sciences in Spain. Please go on. You can see a lot of signatures. Yes, please go on. We have also the heads of service of pneumology, of cardiology, of epidemiology, of the main hospitals in Spain, the main public hospitals in Spain, a lot of them. Please go on. And also a lot of well-known people working on tobacco control from a long time ago in our country. Please go on. You can see a lot of people. And the idea was that because we are, I don't know in other countries, but in Spain, we are used to see in the last times, in the last months, some articles in different media saying that some professor of university, some physician is defending these new products, but the reality is not that. And so we wanted to express very clear the unity of all the health professions around this and all the science in Spain around this. So the idea is that when they will say again that they have some health professionals supporting their ideas, we'll show this unity of all the professionals around this position, that is the position of the WHO, that is the position of all the scientific societies with really importance. So that's what I wanted just to present and to share with you, is the idea that we had in Spain, that I hope it will be useful to transmit to the public opinion, to the idea that this is not the solution, that it's possible to quit smoking, and it's much better to quit smoking than change to these new products. Thank you very much.
Thank you, Francisco, for sharing this very new, fresh initiative from Spain. And maybe I'd like to add that if any of the participants of the webinar from different countries, if they want to replicate this experience, they can contact ENSP Secretariat or Dr. Lozano for our support. Please submit your questions to Dr. Lozano via chat, and we move on with the program. And I would like to present Professor Florin Mihaltan, who is a doctor, a senior pneumologist in Marius Nasta Hospital in Romania. He's also a teaching professor, and he had many roles throughout the years in tobacco control and treatment of tobacco dependence. He has been the president of the Romanian Society of Pneumology and the president of the Romanian Network for Smoking Prevention. And of course, it's my pleasure to mention that Dr. Mihaltan is also on the board of ENSP. So I'm passing the word to Professor Mihaltan. Please unmute your mic and you can start.
Just a minute.
Florin, you have to choose which part, like which file you're sharing, and I think you selected your internet browser instead of the...
Yeah, I'm trying to do it now. Just a minute. I think it's better now.
Yes, we can see it, but you should run it full screen now. Yep, perfect.
Yeah. My proposal for today is if we are looking to this heat not burning tobacco, it's not also our mistake. Here's my disclosure and agenda. What the tobacco industry know is very clear. They are very familiar with this decreasing of smoking prevalence and the wishes of smokers to quit. Of course, they are trying to convince us that are switching to a safer product, and this can be possible without going to doctor. If we are looking to history, it's clear that IQOS is on the first line, and there are coming also other heating tobacco products. And what is probably not so good, well known by people, is that they tried, and the first trial to introduce IQOS was in 2007, but they renounced because the advertising was not so correct. What are our mistakes in this condition? At the first trial to launch this product, this didn't enter in the sight of those on the tobacco control front, and also no independent study at the first moment on the possible impact of these new offers were made. We had no lesson learned from their mistake at the moment of launching this heat not burning tobacco. What are the expectations of tobacco industry? Of course, they are trying to increase their benefits, offering this reducing harm production. And this new era of consumption is with promoting products to young, to non-tobacco users, and to all smokers to convince them to remain smokers. And all this happened in a period when the battle for kids is very acute, and the reality is that they are trying to perpetuate the idea of smoking. What is saying the tobacco industry about their product is, of course, a new product, a very impressive offer. They are saying that this new tobacco offer is without big exposure, without risk, with a good appeal and changing the behavior. And according to the tobacco industry, it's a reduction of harmful substances until 95% of the cytotoxicity until 90%. But in the same time, they are trying to confuse us with mixing information with e-cigarette. They are promoting both. They brought scientific arguments, and this is a little surprising, but it was a surprise also for all the people working in tobacco control. And they study very early the habits of smokers concerning new offers. But finally, they are moving the target for us. And it's totally different what the independent scientists are saying. Here, we have not so many data, and these data are demonstrating that these harmful substances are in high concentration. There are many carcinogenic substances, and as they are doing, and they know very well this strategy, they are manipulating in all the papers, scientific design and statistical analysis, and for former employers and contractors, they have detailed irregularities in the clinical experiments. Independent research, how popular they are. Here, you know that this tobacco heat not burning products have in independent research totally another image with many other substances coming with their toxicity. And in the same time, a big discussion on second-hand effect. Here, there are not so many independent researchers showing their studies, but they are demonstrating that this exhalation from this type of smoking is not without secondary effects with many compounds who are also toxic. And you can see that even for passive smokers or second-hand smoker, it is a danger coming from different chemicals linked to cancer and to other diseases. And concerning this device, when the device is turned off, the exposure is negligible. But if it is working in a closed space, it is a high proportion of particles who can reach the regional alveolar, the region of alveolar, pulmonary alveolar. And where we went wrong is that we had studies from independent researchers started very late. We lost the opportunity of studies on long term, and when the tobacco industry succeeded to publish, the standards of acceptance from the review remain questionable, and nobody spoke very clear about this. And every studies made by independent researcher was creating a debate from the part of the, it was a good opportunity for tobacco industry to create a debate. They are using new strategies. They create, as all the people know, this smoke-free foundation with this logo ending smoking, but this is not an independent, really non-profit organization. And in this real change, they are trying to demonstrate that they are very responsible, but in reality, this foundation are sponsoring great number of other activities, and they are creating this apparently this legitimacy of scientific messages and research originating from this foundation. This gives an advantage because they are using still the Marlboro name also for this transition for smokers to this new products. But in reality, we are confronting many other problems for regulator, and it is very difficult and probably a long process to regulate packaging, indoor use, advertising, and taxation. Many countries made this step, but not for all these components. And in the same time, all the modalities to promote their products are not new. They are using the same themes. They are doing device changing under no regulation, and they are trying to introduce new games. Here you can see also the marketing is very attractive for youngs with this images looking like smartphones. They are organizing scientific congresses, confusing medical teams, and they are using, and here you can see some images from Romania, interactive sites, bloggers activities. They are sponsoring even shows. They are making articles published in some reviews on journals, and they are encouraging all this association. We have an association of smokers defending their rights, and the meetings with parliamentarian and political teams was also important because they organized these harm reduction events sponsored by tobacco industry, using also new website and young incentives, and it's nothing new here. If you are looking, there's the same strategy and promoting activities as for conventional smoking. This is in reality another big danger, but the question remains, are we really aware? And this, remember me, old strategies where they apply the 100 years of marketing lessons. And I think the major mistake here in this moment is that they are using doctors who have not to declare their conflict of interest, and they are not forced by societies to declare this conflict of interest, and this is also a new strategy. Doctors promoting new strategies is also an old scenario if we're looking to conventional cigarettes, but it's working also in this moment. And here, handing big tobacco a major win, despite there are no actually being and evidence in it safer than traditional cigarettes. As Dr. Stanton Kletz said, this is another activity where this FDA approval brought some other secondary problem. With open access to create a public health perspective on smokers and on other attitudes, but this demonstrate they are going in a direction very evident, not only for smokers, but also for non-smokers and ex-smokers, trying to renormalize, to introduce a renormalization of smoking in our society. Is this harmful? If you are looking what people are saying, and youngs, they are very confused. They are not perceiving really the harm of this product. It is also an offer for the minority, but in reality, tobacco nicotine harm reduction products are available to the entire population of smokers. There is no doubt that they are looking for less toxic products, but no doubt is not an attitude. Doubt is their product. And what are the actual facts? Here, after my opinion, we are confronted with a late official reaction coming from World Health Organization, from Director of Bureau of Health Policy, and from FDA Advisory Committee. There are, of course, repetitive make mistakes at high level. And here, one of this was this FDA's authorization to market IQOS. This recommendation was speculated by tobacco industry and for many authorities. It was another possibility to introduce this IQOS as a safer alternative to smoking. And it was practically an FDA green lights interpreted by different authorities in different way. And in this moment, we have enough studies showing that we need to change our attitude. And here I have to emphasize again this European Network Smoking Prevention request for European Union directive, trying to underline what means this connection between this type of products and this promotion in workplaces. What we have to cover is, and this is not well known, how we can reduce motivation to quit using tobacco products, and how they encourage non-smokers to start using. We can do it by our societies, with our educational activities, with contribution of doctors and mass media. But we need not to make other mistakes, referring to harmful and addictive products, to this attitude to undermine smokers' wish to quit. And we need to impose some limitation for this new strategy of renormalization of smoking, and to stop this dual use with conventional cigarettes. In this condition, in this moment, heated tobacco products are not the solution to the tobacco epidemic, and we should not be distracted from the main job at hand. And we need to promote regulatory measures and to support those who wish to quit smoking. In conclusion, looking to WHO recommendation, we must continue to monitor awareness and use of e-cigarettes and heat-not-burning tobacco products, to implement an appropriate policy for this product, and to have more and more evidence on long-term consequences and this harm actions of these products. But I cannot neglect these repeated mistakes we're doing in permitting this promoting strategy of tobacco industry. Our delay in our reaction, this confusing and pro-con discussion, scientific-based, introduced by tobacco industry on e-cigarette and heat-not-burning tobacco, and this impose for us intense training of politician, population, and medical staff, and of course young generation. But one word is very important: transparency must be the word of order. Thank you for your attention.
Thank you very much, Professor Mihaltan. It was a great summary, actually, of what the problem is. And I hope it's a push to all of us, like a call for action. what to do, how to address the problem. And now we are back on track with the program. So I'm gonna pass the words to Dr. Marina Gambaryan, who is a member of ENSP, and she's a lead researcher of National Research Center for Preventive Medicine in Russia, in Moscow. And she has a background in medicine and public health with MD and PhD degrees. And in total, she has more than 28 years of experience in research, practice, and education in the tobacco-related field. So, Dr. Gambaryan, please share your slides.
Thank you. Is it? Okay. Yeah.
Yes.
Well, thank you very much, Paulina, for the introduction, and good day, dear colleagues. Very glad to meet you even in such an online environment. And today I will share our data on use of electronic cigarettes and heated tobacco products in Russia related to marketing, age, and smoking status in the Russian population. So I have these are results from our Russian Tobacco Control Policy Evaluation Survey, and I have no conflict of interest. Well, the fact is that the smoking prevalence is really going down in the population, and particularly it's going down among the youngsters. And this is really markedly registered that in youngsters, the smoking prevalence went down from even 2013 to 2018, up to relative decrease was 46%. Compared to the population at a total which was 3.5%. But parallel to this, novel nicotine products, electronic cigarettes and heated tobacco products are becoming more and more popular due to aggressive marketing of these products, and particularly they are becoming more attractive and more popular among the young age groups. So the aim of this study was to investigate the prevalence of electronic cigarettes and heated tobacco product use related to exposure to advertisement and promotion of these products in the Russian population. We analyzed the data from cross-sectional survey of adult representative sample from Russian Tobacco Control Policy Evaluation Survey, which was done in 2017-2018. And the longitudinal survey was done in 2017-2019, which was based on multiple sampling, so multi-stage sampling in 10 Russian regions and stratified by smoking status. All in all, were interviewed 11,625 people certified as smokers, former smokers, and never smokers. And as outcome indicators, we analyzed electronic cigarettes and heated tobacco products ever used and current electronic cigarettes use, related, of course, to demographic factors, exposure to advertisement and promotion, and of this product. And multiple logistic regression was employed to see these relationships. So the prevalence of electronic cigarettes ever used was 9% in all population, 11% in men and 7% in women. And ever heated tobacco product use was prevalent in 3% of population, and current electronic cigarette use was only in 2% of population. But it was absolutely different situation in the age group 18-24. This was the youngest age group we interviewed because we didn't, for ethical consideration, didn't interview earlier age group, 15, for example. And in this age group, electronic cigarette use was 24% prevalent, and heated tobacco products used 7%, and current use of electronic cigarettes was also in 7%. The less the age, the older the age group, the less the prevalence of these products was. And of course, it was more prevalent in current smokers and recent quitters in last 3 years compared to never smokers and long-time quitters. This was also demonstrated in
multi-level logistic regression, exactly the same what was observed, that in the likelihood of electronic cigarettes and heated tobacco products ever at current use was strongly associated with age, first of all, 7 times more likely to use electronic cigarettes, ever use electronic cigarettes in the 18-24 age group, and the older, the less likelihood, but still very high compared to the most highest age group. And also it was, of course, significantly related to smoking status. The current smokers compared to former smokers were more likely to use these products, and those compared to never smokers also 5 times more higher to use this product. So we decided to look at the relation to, except the demographic factors, of course, to marketing and promotion of these products. And what we realized that the prevalence of respondents who were exposed to advertisement and promotion of electronic cigarettes and heated tobacco products in the past 6 months was mainly at the internet, social networks, and in the shops or shopping centers where these products were sold. But what we discovered that the age group from 18 to 24, the youngest age group, were much higher, were exposed, more frequently exposed to the advertisement and promotion of this product in all sources compared to the total population. And here you see in the blue bars are those who are 18-24, and those and the total population are the green bars. And this is how the pictures show how this is advertised in the shops, big advertisements, discounts, and promoters, of course, approaching people, and especially to young people, because also as our survey showed, the percent of respondents who were approached actively by the IQOS or Glow or promoters in shopping centers, airport or mass events increased from 2017 to 2019, from 3% to 7.3% in the total population, but in the age group 18-24, it increased from 4.5% to 18.2%. And this is really a threat. And here you can see how this is how these products are aggressively marketed also via internet. And what is very shocking that, for example, the right picture shows a search in an academic dictionary for example, an explanation of extracorporeal membrane oxygenation, which has nothing to do absolutely with tobacco products at all. And it still brings up as a pop-up IQOS advertisement, which says, in search of the best of yourself, what is written here. And the other picture also clearly targeted to young people also says, being yourself, being unique. These are the messages how the Philip Morris International is targeting the young people who are otherwise would have not probably gone into smoking, as our research also shows. So what the research showed, the multi-level logistic regression, that chances of being electronic cigarette ever or current users were significantly higher in case of exposure to marketing of electronic cigarettes, to more than 2 times higher likelihood being exposed on the internet, and in social networks, and also on television, and in shops selling electronic cigarettes. And what is very interesting also as a finding is that these findings are really showing where and which kind of products are mostly advertised. Because if the electronic cigarettes are mostly people are exposed in the internet, so what we see on heated tobacco products, like for example the IQOS, the chances were user to use electronic cigarettes were
elevated in those who were exposed on TV and in the shops, 5 times higher who were exposed in the shops selling these tobacco products. This is because this strategy of advertising in shops and mass events is very, very aggressive and very, very popular. And also on sports events, and this is Glow, which is widely advertised in all kinds of mass events. So, but this is nothing new, I want to say. And here is a quotation from Creative Research Group Limited of Imperial Tobacco Company, 1986, which was published in a very brilliant book, Smoke and Mirrors, by Canadian Tobacco War. It's written, it says, unmet needs of smokers that could be satisfied by new or modified products which could delay the quitting process are pursued. And young smokers represent the major opportunity group for cigarette industry. We should therefore determine their attitude to smoking and health and how this might change over time. And these are from also Imperial Tobacco documents from 1970. So this was also and have been also the strategy of tobacco industry, and this is what is carrying on now in this product. And this we can see the changes in a very short period of time from 2017 to 2019, how the prevalence of using these products is changing. And even if the prevalence of electronic cigarette every use is slightly decreasing in total population, it is still increasing, being already high, increasing in the age group 18-24 from 24% to 29%, and this is from 16% relative percent to by 21 relative increase, and the changes in prevalence of heated tobacco products ever use is increasing by 52% in the total population, and 81% it increased. Relative increase was observed in the age group 18-24. This is really a very threatening, and under recent and under the absence of legal regulations, unlike the tobacco product, this is really growing. But as a conclusion, we can say that the prevalence of electronic cigarette is the highest and growing among the youngest age group of adult population. The prevalence of heated tobacco products demonstrates a considerable increase, mostly in the youngest age group of adult population. The use of electronic cigarettes and heated tobacco products is strongly related to exposure to advertisement and promotion of these products, and aggressive marketing and promotion strategy of the tobacco and electronic cigarette industry is targeting the young people at the first place. But the good news is, there is also good news that the new law from just recently, from 31st of July 2020, finally adopted on amendments of the current Russian tobacco control law, was to regulate novel nicotine products as any other tobacco product. So all the articles which are, and this is very comprehensive law, the tobacco Russian tobacco control law, which means banning of advertisement and promotion, banning using in public places, taxation, and that is now also applicable for novel tobacco products. And advertisement of ban of advertisement of promotion of any tobacco nicotine products will come into force from the 1st of January 2021. We hope that this will a little bit change the situation and stop the real growth of the prevalence of nicotine containing products use. Thank you for your attention. If there are questions, I will be glad to answer.
Dr. Gambaran, thank you very much for sharing these interesting numbers, which are indeed very alarming, and for this valuable conclusion when you obviously link the situation with the problem with novel tobacco products and the need for them to be regulated. So last but not the least, we have on the agenda the presentation from Poland by Dr. Paweł Koczkodaj. Paweł has a medical background. He's an MD and PhD, and he's a public health specialist and health educator, currently working as a deputy head of the Cancer Epidemiology and Primary Prevention Department at the National Institute of Oncology. So Paweł already switched his presentation, and he will speak about the challenge that e-cigarettes represent for the national quitline. Paweł, the floor is yours.
Thank you. At the beginning, I would like to thank you for the invitation. It's my pleasure to present this very short presentation on a new challenge, which is e-cigarettes for our tobacco quitline. So yes, my name is Paweł Koczkodaj, and I'm presenting on behalf of our team, Magdalena Cedzyńska, Irena Przegórka, and Krzysztof Przewoźniak. So very shortly, briefly, just a few words about the Polish National Quitline. So it operates in Poland since 1996, and it was the first such solution in our part of Europe. We are like in a part of the tobacco dependence treatment program by National Health Fund program. We are co-financed by the Ministry of Health as well. Unfortunately, all of the services are not reimbursed because medicines are not reimbursed. So it's like partially funded. We have reactive and proactive services, and it's dedicated for smokers, but also for healthcare professionals. We are open for all people who are interested in this topic to call. And here you can see the number of the quitline, which is visible on each package of the cigarettes in Poland since few years. And since that time, we observe like huge increase in the number of calls to our quitline. So it works. Just few numbers. The time of the period of the time is from July to December 2019. So this is the time just before the COVID. So these data are like untouched by the pandemic. So as you can see, the number of e-cigarettes users which were calling to our quitline was at the level of 102. 72% of them were dual users. 15% use e-cigarettes as a quitting tool, and 26% of all of these people from this cohort use this tobacco product as a quitting tool. So 22% people were at the age of 15, 19 years old, and we had also minors like under 15 years old. And these data are really preliminary, but what you can see from this data is that the e-cigarette problem is a really big challenge for in young people group, in teenagers, and these data are also confirmed but, by other data, which I'm going to shortly present. So, of course, UITS. So these data vary. I mean, vary when we talk about the years of the collection. But you can see here that Poland is quite high, and these data are from 2016. So 28% and almost 19% of girls use e-cigarettes in Poland regularly. When we look at the adult population, it's only 2%, but we have to be like cautious because this is emerging problem as well in this cohort. For example, when we look at the example of Japan, where the heated tobacco products, like prevalence of using heated tobacco products in 2017 increased 10 times only during 1 year. So we have to be careful with this, and we cannot disregard this problem. Paul Nikoyev, this is quite a new study by National Public Health Institute in Poland. And it's first study since years on the representative group of teenagers, about 17,000 of people, students from Poland, under 18 years old. And what is interesting, unfortunately interesting only from the scientific point of view, because from this data we know that e-cigarettes is really emerging problem in Poland as well. So 30% of students use e-cigarettes for tobacco initiation. You can see in the next bullet that e-cigarettes is almost is higher now, unlike to traditional cigarettes. So it's almost 30% of users among teenagers. When we look at the traditional cigarettes, it's 26.2%. Almost 13% of students have already tried the Juul e-cigarette. This is quite new thing because it's we have Juul in Poland since September 2019, but it's already visible as well. 78% of adolescents use fruity and sweet flavors in e-cigarettes. This is a simple thing because they want to seize the unpleasurable taste of the nicotine. About 30% of adolescents encounter any form of advertising and promoting nicotine products. And there is also another interesting information because about 50% of all respondents, they didn't know if they were the target of the tobacco advertisement. Maybe this is because of that in Poland it's forbidden to advertise these products, but when you come to the shop, to the point of sale, you can see the placement of tobacco products with colorful shells with lights and so on. So this is tricky, and yeah, this is also interesting thing. This is only one article example, just in relation to previous presentation. I think that the advertisement of new tobacco products is quite strong, because what's this? This is the screenshot from the Polish nationwide radio. And in the green box, you can see Nauka I Technologia, which means science and technology. And the article is about the IQOS. The title is, it's almost 6 million people who changed their traditional cigarettes to IQOSes. Check out why you can be the next. And this article is in a division of science and technology. It's really, really tricky, especially for young people, I think, especially when you read only the lead of the article. But yeah, and of course, there is no information about the financing. So yeah, this is a big challenge which we were trying to address in this year World Tobacco Quitting Day, and on the occasion of this year World Tobacco Quitting Day, we prepared a letter to the editor with Polish specialists in tobacco prevention, cessation, and control, and the letter focuses mainly on e-cigarettes use among teenagers. If you would like to read it, I will share the link just right now, if I can do this now, on the chat. So it's in English. I really recommend you to read it, and maybe you can share it as well. So if you have any other question, I will be happy to answer. Thank you.
Thank you very much, Pavel. And I see the link with the previous presentation. It's again very alarming that many of your numbers refer to adolescents and very young people who are using nicotine products and for whom it might be a gateway to start smoking and consuming other tobacco products. So now I would like to say thank you again to all of our speakers, and we have a few minutes to address the questions in the chat. So I'm gonna read them for all the presenters. So I believe first one is for everybody. What is the most effective way the tobacco control community should respond to the tobacco industry tactics with regards to the heated tobacco products, especially to use and during the pandemic? So if anybody wants to take the floor.
I can start. Of course, it's a good question because we have to learn again the good lesson from tobacco, conventional tobacco. And here, after my opinion, legislation and new rules are needed to stop all this dissemination of fake news or this scientific evidence who are very doubtful and coming from all the scientists sponsored by tobacco industry. This is one of the important moments to stop this new phenomenon. But the second one, after my opinion, is to look a little to doctors and media. And we have this problem also, I saw in many East European countries, but it's the same in Romania. When somebody is informing or is writing something about heated tobacco products, he have to declare his conflict of interest. And doesn't matter if it's doctor. Normally a doctor cannot work for tobacco industry, but it must be introduced as an important obligation also for mass media, because we have our own journalists and journals who are disseminating this scientific evidence coming from tobacco industry. And I cannot imagine how they penetrate in very famous reviews and journals and to introduce these apparently independent works and studies, but all these studies had big problems of be accepted, and they were accepted. And if I'm looking to the COVID phenomenon, we know that it is something similar here. We had some therapeutical agents with publication who were retired from public publication at the moment when it was something doubtful inside. It doesn't happen. It wasn't happened for the tobacco industry. This is a big question for me every time.
Thank you, Professor Mihaltan. If any other panelists.
Pavel speaking, I would like to briefly react on this. I think this is an extremely important question at the moment, and I also think we are facing a very different situation at the moment with this campaign. I commented also in the chat how it is absolutely apparent from hearing these two presentations next to each other, how particularly the PMI is at the moment influencing at the same time the scientific consensus and the mass media and public communication field. And it seems from what we are observing that the international community and institutions and organizations such as the WHO are not providing coordinated enough response to this. It is, I just want to add this recent big conference which took place in Greece about a month ago, where if you look at the conference, there is no mention of sponsorship by PMI. The participants appear legitimate researchers. Actually, some of them probably are legitimate researchers, but the entire structure of this conference is designed so that it produces scientific background which facilitates the industry's purpose. And it's extremely difficult to question this by regulatory means. It seems absolutely legitimate. There is, it's a big difficulty to do this. What is at stake at the moment is that it seems that the industry is targeting the entire public consensus around tobacco control and positioning itself as part of the solution, particularly with this decreasing damage, decreasing harm message. And the decreasing harm message can easily be taken up by governments, very easily in countries like ours, where tobacco control is not particularly well supported. And so I think it's extremely essential for WHO and for networks such as ENSP to activate and coordinate, so we have access to resources, we have ready-made responses. We need to even have scientific evidence which needs to contradict this attempt.
Well, I want to add something to this. I think the regulatory measures like regulating the tobacco products, what we had already have 5 years or more, 7 years already implementing and having quite good results can make a difference. It's just the point that the lobby of tobacco industry is really very very strong, because first this law of amending, for example, in Russia, already 2 years was under discussion, and another 2 years it was going to develop it. And at the end, of course, there were some exceptions. So what was gained back by the lobbyists, for example, the ban of advertising, not advertising, but open display of tobacco products is well working, but for these novel products we couldn't reach that. The sticks of the product are cannot be displayed, but the devices, nobody's can forbid them because they are arguing these are not tobacco products. So this kind of more and more being on the insistent side of regulating these things is one point of taking this product out. And then second is, of course, combined and very massive mass media campaigns and educational campaigns where absolutely no question about harm reduction can be raised, and not as tools for smoking cessation. And here, of course, the unity of medical community is very, very important, and public health community, which is sometimes not, I mean, on an international level is not there, but okay, on the national level, one can also always promote the right ideas and educate the youngsters about the harm of the tobacco, of this new novel products. And of course, forbidding, for example, the snoozes were forbidden after several death cases in children. I mean, these chewing tobacco products were completely forbidden and taken out of the so regulatory measures, I think, but with best confrontation to the lobbyists.
Yeah, Marina, and go ahead, Francisco.
I fully agree with all what has been said. I think regulation is very important. I think the institutions like the ministries of health and so on must regulate this, is acceptable. But of course, we have a very serious problem. For me, the main problem is that we have not the money to invest that they are investing in all these campaigns. And the only thing that we must fight and we must express very clearly is that they have the money, but we have the reason. We are right. And the idea of that there are scientists promoting and defending their ideas is not truth. What we must very clearly say is that the vast majority of scientists and all scientific societies and so on are absolutely against what Philip Morris is doing. Philip Morris is defending their economical interests only. They are paying some physicians and some people, and they are doing investigation. That's another problem. Pavel told before, and Florin and Marin, we cannot do research because that costs money. Who is putting money now in research? The tobacco industry. That's a big problem. We must ask our authorities to invest in science. That's difficult. But they are spending a lot of money. And they are transmitting the idea of that there are a lot of scientists supporting them. And that's not true. That's absolutely false. That was the reason why we in Spain tried to do this manifesto. And that's the few things that we can do is to say that and to say it very clear and repeat that wherever we be.
Thank you, Francisco. And I think actually Marina and Francisco answered the question of Dr. Hania Gomani. He asked about the ban of advertisement of novel products at the place of sale, which Marina addressed. And also, Francisco, now you touched on the second question, which was why we still have not too much of research on the hazard of all kinds of novel tobacco products. So indeed, there is a need for more funds for this independent research, not sponsored by the industry. And I have one more question for Marine from Dr. Tibor Salagai. Do you have any organization in the Russian Federation who does monitor the operation of the tobacco industry on a regular basis? There are lobbying activities, sponsorship activities, corporate social responsibility, submissions to the government, etc.
Well, what I want to say, we have experts who are doing this on their own initiative, but kind of organization on a regular basis, I'm afraid not. I mean, we have governmental bodies which are like Federal Anti-Monopoly Agency, whose task is to monitor all the interest of these companies, but this is really a difficult issue, and we always have to monitor and control. Yeah, and also the agency of there is the organization which is the working on protection of the interest of customers, which is, by the way, a member also of ENSP, to a certain extent also is doing this.
Thank you, Marine. So we're actually a couple minutes behind the schedule, so I'm afraid we have to close the meeting. I would like to thank all our panelists for their contributions. We will share the recording of the webinar and the presentations via the conference website with all the participants. And I'm pleased to invite you to our upcoming webinars of the session. We still have a webinar in partnership with Campaign for Tobacco-Free Kids on marketing tactics of the tobacco industry on 15th of December. And also we have the second part of the webinar on novel tobacco products, because it's such a hot and popular topic that we have a lot of submissions, and we hope to see you there on 16th of December. So all information is available via ENSP website or the conference website, ENSP-ECTC. So thank you again, everybody, for attending and for contributing, and I wish you a very nice day.
Thank you very much.
Bye-bye.